Today's topic is going to be about stress in EMS and how it affects us. We do a job that not many people can do, and we see things that normal people don't see on a fairly regular basis. And that level of stress can begin to wear on us a little bit. So there's a few things we can do to try to help manage it. One is try to get a buddy, and this buddy can be someone, ideally someone you work with, although if it's outside of work, that's okay too. But someone that'll kind of help keep an eye on you and let you know honestly when you're acting differently or you're not yourself or something seems to be bothering you, but also to help encourage you to do things like exercise and get away from work a little bit and take a bit of a stress break. So just someone to help keep you accountable with all that. So as part of that, even if you don't have a buddy to help with that, make sure you take some time to exercise. And this can be, if you're working a 24-hour shift, maybe you can catch a few minutes, 15, 20 minutes somewhere. If not, when you get off work, you get a chance to get rested, head to the gym or go outside and go for a walk or do cycle or something that you enjoy though. And if it's running or swimming or walking or hiking or cycling or something for a little bit of aerobic exercise to kind of get some of those chemicals burned out of your body. Along with that exercise, make sure you keep a fairly healthy lifestyle. So make sure you're eating properly and you don't indulge in too many of the bad things. Occasional chocolate chip cookies, just fine. But make sure you're eating fairly well and that you're sleeping well. A lot of our bodies and our brain's healing happens when we sleep. So make sure you're getting as much sleep as you can when you're not at work. Something that may not be as easy to do, but if your service allows it, you could look at doing sort of a rotating shift. I know the service I work for, two of our trucks rotate stations every week. So they work one station one week, another station another week, and it just gives it a little bit of a variety and a little bit of a break. One tends to be a little bit busier than the other, so they split that up. Again, it may not always be possible, but if your service allows you to do that, that's a way that you can help alleviate some of the stress. Perhaps one of the hardest things for us to do is to remain positive about things. I know a lot of negativity can slip into things very easily, and sometimes we kind of want to go along with the crowd. We end up criticizing a coworker or criticizing a hospital or criticizing a nursing facility, and just try to stay away from those negative things and try to say more positive things. If you can remain positive and encourage those people and talk about the good and compliment each other. If somebody had a challenging call or did something that was really good in a call, to make sure you compliment them on that and say something positive to them. I don't think we get enough positive reinforcement in our job. A lot of times we're quick to say negative things about someone, like he couldn't get his IV in 2 sticks, or he hasn't been able to intubate anybody in a month, and instead of trying to bolster each other up. The job's tough enough already without us going after each other. So try to be positive and boost each other up. Just a little thing that we can do to help make things a whole lot better for our work and our whole work environment, and it'll make things a lot less stressful for us. Now, when the big calls happen, and these are the ones that we tend to think about as sort of like the mass casualty and the disasters and the ones that are really, really tough. It doesn't have to be. You could have a child cardiac arrest, that's one that bothers us, or maybe a coworker was involved in a wreck and you had to take care of your coworker. But there are some calls that maybe are triggers for bigger stress for you. And we sometimes call these critical incidents. And these critical incidents just create a new level of stress for us. Here in Alabama, we had tornadoes several years ago that were very devastating, and most people in the area really recognized that was a critical incident. But again, it could be something much smaller than that triggers this for you. And when these happen, if we recognize it kind of as a service or as a shift, sometimes we'll go through a diffusing, and this usually happens up to about 8 hours after the event, where we kind of get together and we sort of talk about what's bothering us or any emotions or any issues that we have with it. A critical incident stress debriefing usually happens up to about 72 hours after the event, and that's a much more structured event that usually involves some mental health professionals and the opportunity for some follow-up. Now, there's a lot of controversy about these right now because we don't have evidence to show that they really seem to help, or at least help any more than what we used to do, which was you and your partner sitting next to each other in the truck just talking. And that goes a long ways. Or after you run the call, you go back to the fire station and you talk to the fire crew and talk about it. And that seems to be very effective. So we don't know if the CISD, critical incident stress debriefing, is any more effective than what we used to do. However, there is one thing with that, and I mentioned it with the mental health professional. If you feel like something is terribly bothering you and you're just not being able to get over it. Seek out some professional mental health. I know not all services have insurance for it or cover it as part of their workers' comp, but it is something that is very beneficial if you're struggling. Again, this job is very challenging. I hear it all the time from people that say they could never do what I do as a paramedic. And we see things that normal people just don't see. And over time, that does wear on us. And having a counselor, mental health professional, someone that you can talk with, sometimes makes a big difference. So don't be afraid to seek that help out. I know there's sometimes a little bit of a stigma with it, but don't be afraid to seek it out. It can be very, very beneficial. And I've done that. I've had to talk to mental health professionals, counseling services, and I've found it very, very beneficial. So a little bit about stress in EMS and how we can deal with it. Remember to exercise a little bit, eat well, sleep well, find a buddy to help keep you accountable for things, find habits outside of EMS, hobbies, that's the word I was looking for, hobbies outside of EMS that you enjoy and kind of get you away from the job. And when things are getting really bad, if you need to seek some professional help, don't be afraid to do that.